On December the 14th, 2023, the Australian Commission on Safety and Quality in Healthcare introduced new standards aimed at better protecting patients undergoing surgery. The Commission was tasked with reviewing licensing standards around hospitals, day procedure centres and clinics where cosmetic procedures were being performed. This followed a joint investigation between Four Corners and 9 newspapers, which found that doctors without specialist qualifications were operating on patients in privately funded facilities with serious hygiene and safety breaches. The Greens, of course, welcome the more stringent standards that are being put in place. It's appropriate that that occur. But this does not mean that many not-for-profit community hospitals, that many not-for-profit community hospitals will need to undertake extensive infrastructure upgrades in order to meet these standards, and that's going to put a significant cost burden on those hospitals. The Glenelg Community Hospital, for instance, I understand requires $8 million to upgrade their sterilisation department to meet these new requirements. I understand that the Stirling Hospital would require in excess of $50 million to undertake major infrastructure upgrades, including resizing operating theatres, replacing the building's water filtration system. Their most pressing challenge is upgrading the ventilation system in their theatre and procedure rooms, which is estimated to cost $500,000. As not-for-profit community hospitals, any surpluses made by these hospitals are automatically reinvested back into the hospital infrastructure, the equipment and staff. And so these major infrastructure upgrades are beyond their normal annual expenditure, and they do not have the capital reserves required to provide for these infrastructure upgrades. The private sector, health sector in South Australia is facing increased pressure, and look, it's not my role to advocate for the private health system, but what we're talking about here is a community hospital that provides a very important community service. The closure of local hospitals at a community level has put increased strain on the public system. Indeed, over the last decade, rising costs for consumables, wages and services have compounded the challenges that these small hospitals face. Furthermore, revenue from health insurance has not kept pace with the true cost of care delivery. Despite these challenges, not-for-profit community hospitals play an important role in not only providing health care delivery to their respective communities, but also reducing the patient loan burden. I understand, for instance, that the Stirling Hospital partners with the Southern Adelaide Local Health Network to deliver critical services such as ear, nose and throat care, and this is a really important partnership. I also note that in the last financial year ending June 2024, Stirling Hospital had a total of 4,212 patient admissions, including 3,315 day surgeries and 595 overnight stays. The Glenelg Community Hospital in the same period treated over 7,000 patients and worked with SA Health on waiting list initiatives and care for special needs children for dental surgery. These are hospitals that provide a vital community service, and particularly, might I say, of the hospital in Stirling. It operates in an area where there aren't local hospitals. It's a critical service for that community, and its future hangs in the balance as a result of this new regulatory regime. So the Greens are calling on the Malinauskas government to make interest-free loans available to these not-for-profit hospitals so that they can undertake the necessary upgrades, so that they can do the work that's required so that they can remain operational. We're not saying give private hospitals a blank cheque. We're talking about only 3 small community hospitals. This is a bespoke solution for those community not-for-profit hospitals so that they can remain operational. It would be easy for the government to make an interest-free loan available and to work with those hospitals to develop a repayment plan down the track. And so I do urge the government to consider this as an option.